You're about to see some of the biggest pimple pops that I have accumulated this week, and some of them are just so good. We're going to get into some ears as well. Lots of crazy stuff coming up. I'm Dr. Dustin, I'm board certified dermatologist, and welcome to my channel. Let's dive in. Starting out with some blackheads here right around the eyebrow. These look like they should come out pretty easy. We've got gloves on, starting out really well. Not even needing any tools here, they're just popping right out. Kind of scraping it away with some tweezers. Now we're coming in. That's an 11 blade. So, sharp blade just to open up the top, gentle pressure. Very good result. If you've been on the channel long enough, you know what my recommendations for skincare are going to be on this. Salicylic acid and retinol. Maybe weekly exfoliation with glycolic acid could be helpful here. I'll try to link some products that I would recommend for this. Try to improve the skincare here. There are a lot of blackheads in this area though. You can see a lot more texture to the skin once they start to squeeze it. You can see how much is actually hiding underneath the skin there. Some of these have ingrown hairs in them. Look at that, all curled around. Here we have a lot of blackheads around the lip line. This is a tender area to try to treat, and they're just gonna go for it. Let's see what they're using. Fingers, pops out pretty easy. And they're coming in with the 11 blade to kind of scrape it away. I feel like they need to come in with some of those Q-tips to try to get more precise pressure around these areas. But they're coming out nonetheless. It's just that when they're squeezing, there's a lot of others around there that they're mashing on. Boom. I think this is from Sac Dep Spa in Vietnam, actually. They're always wearing their gloves. We got a lot of blackheads all the way up to the nose there. But getting a good result here, popping them out, these are going to look a lot better. Just lightly loosen up the top with that 11 blade and boom. But there's a lot. The farther we go over on the lip, the more we're seeing. Hit that like button if you'd like to do this to somebody. Just a little blood on that one. Good job. Next up, we've got a child with some impacted earwax. And they're using a tool here to try to loosen it up. I'm not sure if this is putting water in there or a solution to dissolve it, or if that's just suction. It could just be suction where they're trying to get a hold of it and pull. Now we're coming in with the spatula tool. Do not do this at home, especially in a child. That eardrum is not as far away as you think. So this needs to be done by a professional. But ooh, that is a big chunk of earwax. Boom, look at that. Crazy. Now we've got a big blackhead in the ear. We've talked about this. There's tons of blackheads that appear on the ear. Some people are just prone to this. It's a common area for cysts. And that is a big old chunker that comes out of there. Look at that thing. There's a couple more we're going after. Loosen those up. This is from Blackheads Popping on TikTok, so thank you for letting us use your video. They have tons of them on their channel if you guys want to check them out. This one's been there a long time. You can tell because the top, all that oil is oxidized. It turns black once it's exposed to the air after a little while. Using the tweezers to pull that out. It's kind of falling apart. Looks like those two are connected underneath the skin actually. Getting a little different tool. Gives you a little more leverage on it, broader surface area to grab it with. just at a different angle. They're struggling a little bit though. They've got to give it to us before the video's over. Come on. Get the whole thing. There we go. I feel better now. This patient has a ton of acne on the face. These are like big milia almost. We're opening those up with a little 18 gauge needle and they pop out nicely. The result on this, the before and after, is going to be incredible for this patient because these are very visible. The skin has been probably neglected for a while here. Get them on a good routine and keep these from coming back. But it looks like the whole thing is coming out. I don't think we're leaving behind a sac that's going to fill back up or anything. Hopefully the person's been numbed because this would definitely be a little tender. They're using the side of that 18 gauge needle almost like a razor to open up a little hole in these things so they come out easier. Like a little pearl. See, they're getting the sac out now. So this will have a good result for the patient. You gotta be careful using that needle right on your glove. They're just pushing them between each other. It's an easy way to poke yourself in the clinic. You don't want to do that. Yeah, this person's gonna be very happy with the result. Look how much stuff is on the glove. It looks like popcorn kernels. It looks like they're pulling out little popcorn kernels that haven't been popped yet. Is that appetizing? You like that comparison? I know some of my patients watch these videos, so if you didn't like me calling it popcorn, just let me know. We are in the ear again with another big blackhead. They're coming in with some sharp forceps and try to loosen up around the edge. These things just kind of get stuck down in their little hole. So you got to loosen them up and then they're going to try to pluck it out. We're going to watch and see if they do. See what they can get out here. Come on. Speed it up a little bit. I have to see the end now. Committed. It's slowly working its way out of there. They're just being gentle around the side there. No doubt it's a little tender for the patient. But without manual extraction, this thing's never going to go away on its own. Oh, here we go. They get it. They got most of it. I think there's still a little bit in there. Try to work out the rest of it. Video's coming to an end. Are we going to get it? Are we going to see it all? Come on. Yes. That's when it's satisfying, is when the job is done right. This person has a lot of cysts. I think this looks like it's on the back of the neck almost. So we're using a comedone extractor to kind of lift these off of the skin, kind of using the fingers to mash them out. That just looks like toilet paper. At least we've got gloves on, but this looks like a towel around their neck and toilet paper. So I'm not sure if this is being done in a clinic. This is a hobbyist at home. That's my guess. Now we've got some tweezers there in the hand. Oh, it's more of a little lancet. Just put it on the toilet paper. It's definitely the right way to do it. You know, if you're doing this at home, hopefully you've cleaned the skin a bit. You're using tools that have been sterilized, if not significantly disinfected. They're getting a ton of stuff out of here, though. Some people just have more cystic skin, and they're just prone to these a lot more. While some acne is related to diet, not all is. I've just definitely seen people who get cystic skin through no fault of their own, just kind of genetically. you're doing this in the clinic, typically you're going to have them take off their jewelry and things. It just increases the risk of infection. We want to clean the area, drape them appropriately. Got an ingrown hair. Just not sure where this is being done at. I don't know if this is a barber shop, if this is a med spa. What are we doing here? These are some big blackheads. At least we've got gloves on, but I don't know if this is in a clinic. There's a lot under the skin here. This is going to take a lot to get that out, and they have several of them. This is probably a little bit older patient because I'm seeing what are called seborrheic keratoses on the back here, and that is something that happens with more birthdays, so when you get older, and sun exposure, your genetic predisposition. Now they got a big chunk of that out. Yeah, you can see gray hair here, so it makes sense. A little bit older patient, several seborrheic keratoses on the back. These cysts have probably been there for years. And this person just talked him into letting them go for it. Do appreciate that they put gloves on, though. At least they're doing something right, although doing this at home, not ideal. Just getting every little bit out of there. Now we've got a comedone extractor. They have several good tools as well. I just am not sure where this is being done at. Where they've got tools and gloves, but some of the videos on this channel have definitely not looked like they're in a clinic. All right, what else have we got? They're just still going for the same one. Now we're coming in with the tweezers, trying to get the sac and pull it out. Got to give it to them. They're not giving up on the job. They're still going back for more. It just keeps falling apart though, so I don't know if they're going to be able to get it all out. But I want to see the end. Okay, now we're getting more up. All right, we didn't get all of it, but we got a lot of it. Coming back with an impacted ear. So this person has a ton of wax in their ear. This absolutely should be done with a professional. I don't know why they've only got gloves on one hand. I presume they just do that because they can get better dexterity of the tool without a glove, but still, it's not that hard with the glove. I'd be using a glove here. Don't do this at home. Don't stick metal objects down the ear canal. This better be a professional is all I'm saying. But that is a huge chunk of wax. Look at that thing they're pulling out. Like, what is that shiny part? They lose a piece of metal in their ear? Man, that's wild. Everybody's favorite, a good pore strip video. Let's see all these blackheads come off of the nose. Blackheads and sebaceous filaments. Their worst enemy is a good pore strip. So much good stuff. Some of these are really small sebaceous filaments. Some of them are bigger blackheads. But they're coming off very nicely. With the right skincare, we can limit the risk of these all coming back. This is a pretty large and juicy cyst. I'm guessing it's on the back of this individual. Gratefully, we've got gloves. It looks like they got gauze. They've got the right kind of tools here. I'm hoping that the patient has been numbed up. We see the liquid on the skin, so that may be because they did anesthetize the patient. That's going to make them a lot more comfortable as you mash on this thing. Look at the stuff coming out, though. This has been there a long time. It just goes rolling off of their back and they catch it. Looks like they got 2 openings to this cyst. Maybe this is a whole new one. But yeah, this is gross stuff. It would smell bad. It's been in that back for a long time. Then the question is, when you mash on it like this, if you don't get the sac out, is this just going to grow back? This looks like worms or poop coming out or something. I mean, I like doing this stuff in the clinic, but even when they're like this, even I can get a little queasy. We've got a cyst or a pimple here on the ear. They're using a little lancet to open up the top. Hard to say how much is underneath the skin here. We're going to see what they get out. They've got gauze, they've got gloves. They're using a sterile lancet, so we're off to a good start. Look at all this material come out. Not quite as much as I thought. We'll see if we get more out of here. I don't know if the patient's been numbed up or not, because that'd be kind of tender. Yeah, there's still stuff under there, and they're struggling now to get the rest of it out. Several blackheads. It looks like some old scarring here from acne in the area. Yeah, several different openings here. Not the greatest quality of skin. Unfortunately, genetics play a role in that. They're getting a bunch of stuff out though. Hopefully with chemical peels, the right skin care, we can limit how many of these are going to come back with time, give them an improved quality of their skin. This is not your typical cyst. What you see coming out of here is not the normal cyst-like material, because this is probably something called a steatocystoma. Some people are prone to a condition called steatocystoma multiplex, where they grow these little oily cysts all over their skin. The material is a lot more oily than your typical keratin-based cyst contents, and they're really fun to remove if you get the chance to. Finishing up here with a big blackhead on the back of the ear. They've got gloves on. I would remove the jewelry here if I'm working around the ear, just increases the risk of infection. They used a blackhead removal tool, popped it out. Well done. Guys, thank you for joining. Hopefully you enjoyed these as much as I did. Let me know which one you found to be most interesting. Maybe the steatocystomas, maybe the giant cysts all over the back. I don't know. Let me know. Tell me down in the comments when you guys watch, like, comment, subscribe, share the videos, or purchase any skincare through the links down in the video description. It helps support my work of providing free dermatology care to underserved populations. I've got a motorhome I've turned into a clinic, and we go provide care for free. So I fund that myself through the work that I do here on YouTube. So thank you guys for supporting that mission. I'll see you guys on the next video.